Hello everybody, my name is Cynthia. I'll be your nursing student. I'll be discussing about ostomy care. Now let's start discussing about the outcomes that are expected for the patient. Patient outcomes. So by the end of this teaching, the patient will feel more confident in understanding and performing their ostomy routine. Patients will accurately describe the characteristics of a healthy and abnormal stoma. The patient will be able to verbalize when ostomy needs to be changed. An ostomy is a surgical opening in the large intestine or any part of the intestine, depending on where the procedure needs to be taking place, on the abdominal wall, out onto the skin surface. And usually these types of ostomies are gastrostomy, the duodenum ostomy, the ileostomy, the colonostomy, or urostomy as well. And what they do is when it's creating the stoma, they just take the intestine, they invert it, and then they sew it in. And usually in that stoma area, it's like pink. It should be pink and red and moist towards the end of the inflammation and stuff like that after the procedure when it's all done within weeks. And you should feel no pain. You will see some bleeding here or there. It's sensitive. It's within range. There could be many reasons why patients will end up getting an ostomy. It can be cancer related, it can be inflammatory bowel disease, it can be birth defects, injuries, trauma, obstruction. Many reasons for a patient to receive an ostomy. There are 3 types of ostomies: the colonostomy, ileostomy, and urostomy. So with the colonostomy, this involves the large intestine. The stool is passed through the stoma. Usually this is more a solid form of stool compared to the ileostomy. This involves with the small intestine. It diverts waste, and usually the waste will not be solid compared to colonoscopy. It will be more fluid, liquidy. And then urostomy, this is more, it involves with urinary system. It diverts urine away from the disease or defected bladder, and you'll see more urine output coming out from there. And usually we'll see this on the right side. Like with the colonostomy, it'll be usually on your left side. Let's move on to the care. When caring for an ostomy, it's important to document whether it's pink, healthy, moist, the output, the gas, the application, any leakage. And it's important to document when it needs to be changed as well. And for an ileostomy or urostomy, it needs to be 2 to 3 days, and a colostomy needs to be 5 days. And I'll be demonstrating the proper care and skills in order to clean and maintain a stoma to prevent any infections or irritation. And as well as important to maintain your emotional health. So attending support groups, gathering as much of your social support groups to help you to maintain that healthy and improve healthy lifestyle and quality of life as well, bringing in everybody who's there for you. So for the pouches, there's 2 of them. There's the 1-piece pouch system and the two-piece pouch system. The 2-piece pouch system is more expensive compared to the 1-piece pouch system. Each of them have the advantages. So with the 2-piece, you're able to remove the pouch and just toss it and put a new one, compared to the 1-piece where you will have to remove everything, since this comes into one. Usually it's more cheaper and has more benefits, and your insurance more likely will pay for that one more. The second piece is more bulky compared to the 1-piece. It's easily hidden. It's important to make sure that you know when to empty out your ostomy bag. So rule of thumb is when it's 1/3 full or 2 1.5 full. And you'll do this by sitting or standing by a toilet, and you open the bottom and you'll just take time to remove everything. And once you do that, make sure that you clean the inside only to the white place to remove any fecal and in order to avoid any odor as well. You can even spray stoma odor inside there as well to avoid anything. So while you're doing this changing, it's important to assess your stoma. So what you're looking for, making sure that it's pink, red, and moist. You want to see any signs for any irritation, any, let's say, rashes. At times there can be cases where your stomach can become necrotic stoma. There's times where it can be retracted. There's times where it can even prolapse. So it's always important to notify your healthcare provider so you can avoid any complications later on in the future. And it's always good to measure your stoma. You especially will do this when you're changing your wafer to have the right fit for it. Like here I mentioned before, measuring your wafer, you have to leave some room, but not too much room. And when you're cleaning, I'll be showing this later on, make sure you don't use any wipes that include any soap, oils. Just preferably use water to clean the area.
Under the patient on the side of the stoma. And then the first thing you want to do is assess the output from the stoma. So if you have a clear bag, you can actually see the output through the bag and visualize it that way. Otherwise, you'll need to empty it. In order to clean and assess the stoma, we have to remove the bag. So start by peeling the wafer and just pushing the skin down away from it gently. You might need to use warm water or alcohol here if the adhesive is tough. Now you want to clean the stoma and around it with a washcloth with warm soapy water. Just use gentle strokes. You don't want to scrub. Then you want to pat the skin dry with a towel. Again, don't rub, just pat. So now that the stoma is clean, you can actually do your assessment. So you want to inspect the stoma itself. It should be light to dark pink and moist. What you don't want to see is dark red, pale purple, or any kind of bluish color. None of those are good signs. They all represent problems with perfusion and should be reported right away. And of course, look for any skin breakdown. So now you want to measure the stoma and cut the hole of the wafer to be about 1/8 of an inch larger than the stoma. If it's too small, it can actually cut off circulation to the stoma itself. So you're going to use a pair of scissors to cut around the inside hole of the wafer. Now, some wafers, depending on the brand you have, some of them have little measurement tools, some of them don't. So just make sure that you are about 1/8 of an inch larger than the stoma itself. If you need to, apply skin prep or barrier to the skin around the stoma, and then remove the backing from the wafer and apply it to the skin with the stoma in the center of the hole. Now, for patients who've had a stoma for a long time, they may have a preference here of which angle they would like their bag going. Some of them like it going straight down, some of them like it going off to the side. So just make sure you talk to your patient about that. Now, as you're smoothing down the wafer, if you do get any creases that you can't smooth out, you can use a barrier paste to fill that in. If you're using a 2-piece system, apply the wafer first and then snap on the bag. Just make sure the bag is closed and sealed based on whatever type of bag you have. Discard your supplies, wash your hands, and document your
evaluations. So the patient will feel more confident understanding and performing their ostomy care. So this means the patient will demonstrate the ostomy care routine to a healthcare provider or the nurse, myself, or the patient will correctly identify the necessary ostomy supplies, and the patient will rate their confidence between a level 1 to 10. Usually the target will be a 10. Usually the target will be an 8. The patient will actually describe characteristics of a healthy or an abnormal. So meaning the patient will list 3 characteristics of a healthy stoma: pink, red, and moist, and painless. The patient should never feel pain with their stoma. The patient will at least list 3 signs of abnormal stomas, like a dark color, dryness, bleeding, prolapsing. And the patient will verbalize when ostomy pouches need to be changed. So the patient will state the average duration of an ostomy pouch can be worn. The patient will identify at least 3 signs that indicates the need for an immediate pouch change. And my references. Thank you for watching my video.